If you've noticed that your memory isn't quite what it used to be, maybe you forget where you placed something, or a name that used to come easily now takes a little longer. You're not alone. And for many people over 60, the first thought is always the same. It's just aging. But what if, in some cases, it's not? What if something else, something much quieter, is playing a role behind the scenes? You see, after years of working with older adults, I've noticed a pattern that doesn't get talked about enough. People come in worried about their memory. They say things like, "I feel a little slower than before. I walk into a room and forget why I'm there. I lose track of conversations sometimes." And they assume it's just part of getting older. But when we take a closer look, sometimes we find something unexpected. Not a disease, not a major condition, but something far more subtle. Sometimes it's the medications. Now, I want to be very clear before we go any further. This doesn't mean medications are bad. And it absolutely does not mean you should stop taking anything you've been prescribed. But it does mean this. Some medications, especially when taken over time or in combination, can affect how the brain functions. And in certain people, this can show up as memory changes, confusion, or what many describe as brain fog. This is where things become important, because these effects are often mistaken for something else. They're mistaken for aging, or worse, early dementia. And that's where unnecessary fear begins. So today, I want to walk you through this clearly, not to alarm you, but to help you understand what may be happening inside your body. We're going to talk about why memory can change, how certain medications can play a role, and what signs you should never ignore. Because once you understand what's happening, you regain something very important. Control. Let's start with something simple. Your brain, even as you age, is still incredibly active. It's constantly sending signals, processing information, forming memories, and helping you stay aware of your surroundings. But for all of that to work properly, your brain depends on chemical messengers. Think of them like tiny signals, moving between nerve cells, helping everything stay sharp and connected. Now here's where it gets interesting. Some medications can interfere with these signals, not intentionally, but as part of how they work. And when those signals are slowed down, blocked, or disrupted, you may begin to notice slower thinking, difficulty concentrating, forgetfulness, or feeling mentally off. And the tricky part is this. These changes often happen gradually. So instead of noticing a sudden shift, it feels like something that's just happening over time, which is why so many people never question it. Now let's talk about one of the most common groups of medications involved in this. Sleep medications. Many people over 60 struggle with sleep, waking up in the middle of the night, having trouble falling back asleep, or simply not feeling rested in the morning. So naturally, they turn to something to help. Sometimes it's a prescription. Sometimes it's an over-the-counter sleep aid. But here's what many people don't realize. Some of these medications work by slowing down activity in the brain. That's what helps you fall asleep. But it can also have another effect. It can carry over into the next day. And in some people, especially with repeated use, this can show up as grogginess, slower thinking, difficulty focusing, and yes, memory changes. Now again, this doesn't happen to everyone, but when it does, it can be very confusing because the person isn't thinking, my sleep medication is affecting me. They're thinking, something is wrong with my memory. And that's how the misunderstanding begins. Now, here's something that surprises a lot of people. Some of these medications aren't even labeled as sleep drugs. Now, this is where many people get caught off guard, because some of the medications that can affect memory are not what you would expect. Let's talk about allergy medications. You've probably seen them before. Some are used for sneezing, itching, runny nose, and many of them are easy to buy without a prescription. But certain types of these medications work in a way that can affect the brain. They belong to a group that can block specific chemical signals. Signals that are not just involved in allergies, but also play a role in memory and thinking. So while they may relieve symptoms like itching or congestion, they can also, in some people, slow down mental sharpness. Now, here's the important part. This effect may not be obvious right away. It can feel like you're a little more forgetful than usual. You lose your train of thought more often. Conversations feel harder to follow. And because these medications are so common, people rarely suspect them. In fact, many take them regularly without ever connecting them to how they feel mentally. And this is where things begin to overlap. Because when memory changes are subtle, they don't feel like a problem at first. They feel like something you can brush off, until they start happening more often. Now, there's another category that is even less talked about, but just as important: bladder medications. Many seniors take medications for bladder control, especially for symptoms like urgency or frequent trips to the bathroom. These medications can be very helpful, but some of them work by relaxing certain muscles and blocking signals in the body. The challenge is, those signals are not only in the bladder, they also exist in the brain. So in some individuals, these medications can affect how clearly those signals are processed. And over time, this may show up as mental fog, difficulty concentrating, forgetting small details, or feeling less mentally sharp than usual. Now imagine this. Someone is taking a sleep aid at night, an allergy medication during the day, and something for bladder symptoms as well. Each one on its own may seem harmless, but together, they can begin to compound. And this is something many people don't realize. Because no one medication stands out as the problem. It's the combination and the duration that can make the difference. Now let's talk about another group: stronger pain medications. These are often prescribed for chronic pain, joint issues, or after certain medical procedures. And again, they serve an important purpose. But some of these medications can affect the central nervous system, meaning they don't just reduce pain, they can also slow down reaction time, affect alertness, and in some cases, cause confusion. This is especially important in older adults, because as we age, our bodies process medications differently. What your body tolerated easily at 40 may affect you very differently at 65 or 70. And this is where many people get stuck, because they're doing everything right. They're taking what was prescribed, they're following instructions, but something still feels off, and they don't know why. Now I want to pause here for a moment, because this next part matters. None of this means that these medications will affect everyone the same way. Some people take them for years and experience no noticeable changes at all, but others may be more sensitive. And when that happens, the signs are often subtle. So instead of something dramatic, it feels like a slow shift, a kind of quiet change in how your mind feels. And this is exactly why it's so often misunderstood, because it doesn't feel like a medication issue. It feels like something is happening to you. And that can be unsettling. But here's the important thing to remember. When you understand what might be contributing to these changes, you move from confusion to awareness. And awareness changes everything. Because now, you're not just guessing, you're paying attention. Now at this point, you might be wondering, how do I know if this applies to me? And that's a very important question, because the goal here isn't to make you worry, it's to help you notice what may already be happening. So let's talk about a few signs. Not dramatic symptoms, but small, subtle changes that are easy to overlook. You may notice you walk into a room and forget why you went there. You misplace things more often than usual. You struggle to find the right word in conversations. Or your thoughts feel slightly slower than before. Now, on their own, these things can happen to anyone. But here's where you should pay closer attention. If these changes started after a medication was introduced, became more noticeable over time, or seem worse at certain times of the day, then it's worth taking a closer look. Especially if you find yourself thinking, "This doesn't feel like me," because that feeling is often the first signal. Now I want to share something important with you. Not all memory changes mean dementia. In fact, many cases of memory issues in older adults have reversible or manageable causes, and medications can be one of them. But this is where we need to be careful, because the solution is not to suddenly stop taking anything on your own. That can actually create more problems. Instead, the right approach is awareness, followed by the right conversation. If you begin to notice these changes, here's what you can do. First, take a moment to review what you're currently taking. Not just prescriptions, but also over-the-counter medications, sleep aids, allergy tablets, anything you use regularly. Because sometimes, the most common products are the easiest to overlook. Second, pay attention to patterns. Do you feel more foggy in the morning after taking a certain medication? Later in the day? These small observations can be incredibly helpful. And then, bring this information to your doctor, not with fear, but with clarity. You can simply say, "I've noticed some changes in my memory, and I'd like to review my medications to see if anything could be contributing." That one conversation can make a big difference, because sometimes a small adjustment is all it takes. A different medication, a lower dose, or even a timing change. And in some cases, people begin to feel clearer again. Now, I want to say this gently. It's easy to assume that every change in memory is permanent. But that's not always the case. And the earlier you notice what's happening, the more options you have. So if you've been feeling a little off lately, a little slower, a little less sharp than usual, don't ignore it. But also, don't jump to the worst conclusion, because sometimes the answer is simpler than it seems, and sometimes it's something that can be adjusted. You're not alone in this, and more importantly, you're not without options. Now, before we end, be honest with me. Have you ever walked into a room and forgotten why you went there? If that's happened to you, just type "me" in the comments. I'd also like you to do something simple. If you're comfortable, tell me your age and where you're watching from. It helps me understand who I'm speaking to and create videos that are more helpful for you. And if this was helpful, take a moment to share it with a friend, parent, sister, or brother. It might help them understand what's going on in their body. Sometimes, the right information at the right time can make all the difference. And in the next video, I'll show you the early signs of memory decline most people ignore until it's too late. If this kind of information matters to you, go ahead and subscribe, because these are the things no one really explains clearly. Take care of yourself. I am Dr. Alex Reynolds, and I'll see you in the next video.